Well, hi, my name's Nangle. I'm the owner of WaiverProvider.com and SupportCoordinators.com. These are two websites that are designed to help people be able to get information about the Medicaid waivers that you can truly understand. Also, it's a place that you can find people to help you and your loved ones. Here with me today is Bob Foley, the business unit leader for the Delmarva Foundation here in Florida. Hi, Bob. How you doing today?
Great. How are you, Aaron?
Good. Thanks for inviting me here today to talk with you. First, can you tell us a little bit about who you are, what your position is with the Delmarva Foundation?
Sure, absolutely. Again, my name is Bob Foley. I've been with Delmarva since 2001 when we first began the program, and I am currently business unit leader. I'm additionally the Vice President of Disability-Related Programs, and I basically oversee our Florida project. I oversee our South Carolina project, oversee what is now going to be our Georgia project, and am involved in any of our developmental disability-related programs and other disability-related programs throughout the country. Historically, I have a long history here in Florida. Worked in the ICF world. I have worked in group homes, lived in group homes as a live-in manager. I've been involved in director of a support employment program. I've managed other group homes. And I was involved for about 8.5 years as an administrator of a support coordination program here in Florida. And that's brought me here today, all of those experiences.
Sounds like you've had quite a few different experiences.
Absolutely.
Okay. And can you tell everyone about the history of the Delmarva Foundation? How long has Delmarva been in existence? When did Delmarva begin working with the home and community-based waiver program?
Absolutely. Delmarva's been around since 1973. And our corporate offices are up in Easton, Maryland. Began with a number of physicians working together to look at healthcare-related issues in Maryland specifically. Since then, we have grown to be a national organization. We're a quality improvement organization. I'm not sure if you're familiar with that term. Prior, we were known as a peer review organization. Basically, it's a national standing that enables us to do certain work throughout the country, respond to certain contracts throughout the country. The quality improvement activity itself is often involved with hospitals, nursing homes, looking at quality of care in those environments. We have an external quality review program where we look at managed care providers throughout the country. We are involved in utilization review. We have a fraud and abuse program. So a variety of work outside of what people in Florida would know as Delmarva's activities. Within Florida, obviously we're working with people with developmental disabilities in the quality assurance program. We have experience prior to that in Maryland and the District of Columbia working with people with developmental disabilities, but not along the same lines of what we've been doing here in Florida. The Florida project actually began in 2001. The ITN came out from the Department of Children and Families at the time, and now APD, but it's through ACA, through the Agency for Healthcare Administration, and it's really been an opportunity for us to kind of expand our work in this particular field.
Okay. And how is Delmarva funded?
Well, the funding stream, and corporately, we're involved in a number of programs. So there's state funding mechanisms, there are federal funding mechanisms. Here in Florida, our funding stream goes directly through the Agency for Healthcare Administration. We're funded through dollars that are both state dollars and federal match dollars. One of the very interesting and I think positive components of the state utilizing the Quality Improvement Organization is we're able to draw down a 75% match on dollars. So if the state puts a dollar out there, it can draw down 3 federal dollars as well. So we have 4 times the buying power in a sense to be able to apply resources to the quality assurance system.
Which is a good thing.
Absolutely.
Explain Delmarva's philosophy and who designed it. Basically, what does Delmarva stand for?
Philosophy, I guess when you get into philosophy, then you start talking about mission, you start talking about vision. Corporately, our mission is really to improve the health in the communities in which we're working. So that's kind of a global mission statement that does apply to this program as well. As you know, we look at health and safety components within the context of this program. We've looked at psychotherapeutic drug studies, a very significant medical component, medical peer review component to this process since it began. So that overriding Delmarva mission certainly comes into play in this program. If you looked at what is our Florida vision, how is that applied, it really links to some of our review processes now, and it ties into how do we help the system to improve, to really generate results for folks. You know, results that they've communicated to us, results that are meaningful to them, that they would prioritize and say, hey, in my life, this is what I want to see happen. How can we, as a quality assurance entity, help to, I guess, bolster up how we can help the system to kind of enhance its focus on individuals, on that person-centeredness, and truly be able to help people to meet those results they want in their lives. So that's really what it links to. Delmarva's philosophy, you know, is in a sense solely linked to the state's philosophy. You know, if we're providing services in you know, Florida versus in South Carolina, this program is designed based upon what Florida desires. It's based upon what Florida has put out there in their proposal, and based upon what the changing philosophies and desires are of the Florida system. And so as a quality assurance entity, we're not necessarily saying we're bringing in our mission to Florida, we're bringing in our philosophy to Florida. It's, you know, we have a mission, this work falls within our mission, but it's really up to the state of Florida to define, and they have through Agency for Healthcare Administration and Agency for Persons with Disabilities, to really say, here's the philosophy we want you to apply to our quality assurance program.
And two of the Delmarva tools are the CORE and the WISCC. What do CORE and WISCC stand for?
Well, the CORE is the Collaborative Outcome Review and Enhancement Program, and the WISC is the Waiver Support Coordination Consultation activity. And these two really came about back in 2004. We really started the development of those items. We had initially conducted provider reviews and person-centered reviews. And if you recall, I'm not sure your involvement in the system back in 2001, but the provider reviews were, you know, very much oriented towards process. Do you have this document? Do you have it? You know, 170, 180 elements. Do you meet this? Do you meet this? Do you meet this? Back in 2003, I guess at the end of 2003, we were really given a bit of a new directive from ACA and APD. At the time, Shelley Brantley was with APD, and she was, I think, leading a lot of that process of saying, we want to see the quality assurance system shift some from the quality assurance to quality improvement, from a focus solely on process to a focus on outcomes. So she kind of sold that process, additionally with Bob Mariansky, who was with ACA at the time. And they presented that to us and said, you know, we want to see the system shift.
So then basically, how would you say that the tools differ from each other, and how are they kind of the same?
Well, they differ from the previous tools in that the focus really became even more person-centered. The focus really became more results-oriented, and therein lies the vision that I mentioned a bit ago. You know, it's driven by the person. The vision is there to generate results in people's lives. And that process applies to both. So in a sense, the CORE and the WISC are very, very similar. The difference, I think, the one difference that jumps out is just who they're targeted towards. So the WISC is for support coordination evaluation. And the CORE process is a consultative activity set up for the provider network. But the reality is they link very closely. And if you look at the elements and how they compare, we have developed where the first portion of each instrument is more outcome related. It's looking at kind of defining what it is the person wants and what systems are in place that are person-centered to help them to achieve those things. If you look at the last elements for the CORE and the WISC, it's really focused on still some of those things from the initial provider reviews we were doing. More of the process-oriented, is training in place? Do background screenings take place in a timely manner? Is there documentation to substantiate billing? All of that. So that essence, I guess that foundation that was built through the first couple of years of our process with providers and the systems people have in place, we still look at those, but it becomes one half of the process with the other portion being outcome oriented.